This little video series is called Dying Dar's Way, Radically Real Spiels on the End of Life. Today I am going to read an opinion piece because I don't think that I can get through this one ad-libbing it or doing it as a discussion with friends. It's called Rationing Healthcare and Killing Grandma. My purpose in writing this document is to spare you and your loved ones unnecessary suffering. I'm asking you to think, to have important conversations, and to make informed decisions about your personal responsibility for self-care and for rationing health care. I'm dying. I have nothing to lose in talking to you about rationing healthcare and your personal responsibility to take care of yourself or to simply require less healthcare. Politicians don't get elected by being real about living responsibly. Regardless of what vocabulary we use to describe the apportioning, healthcare is now and always has been rationed. Some people call this killing grandma. I'm grandma. I'm dying. No one is killing me. I have simply chosen hospice care over grasping at thin straws and slender chances of a little bit of life extension. But killing grandma is what some people call it when you're trying to have a rational discussion about end-of-life decision-making, including the decision to accept the inevitable, death. What we need is safe and sane discussion about how we share finite resources, not just in Washington, but around our kitchen tables. Some of us have more options than others. Like me, I have a lot of options. I have options related to having insurance through affordable care. Options I have because of where I live. I still have a brain that works. I have the option of signing directives saying rescue me under all circumstances or do not resuscitate. I have the option of choosing a new cancer therapy that might extend my life a little bit for $100,000 a year because the insurance company would have to pay for that. I have terminal lung cancer. I choose hospice care. Being radically real about dying and making videos about death planning have introduced me to lots of people who are inspired to have important conversations, to make the decisions while they're still able to do so and to take care of business. I hope that you will be inspired to have real death conversation with the important people in your life, or with anyone. Just get started with anyone who's willing to do so. And here are the questions that I hope you'll ask. 1, would you want your life extended? Would you want it extended at all costs? 2, do your loved ones know your wishes around treatment and life extension? Have you documented them? 3, would you say, save me at all costs, if you had to pay the bill? Would you say, save me no matter what, if it meant that you used up the family resources, leaving little or nothing for the living and the more comfortable dying of your survivors? I have to interrupt myself for a moment here and say that the #1 cause of bankruptcy in our country is medical costs, even among the people who had at least some health insurance. That's a lot of bankruptcy around something as inevitable as death. If we aren't having these conversations throughout life, if we aren't normalizing death conversation before it becomes urgent, we may be hurting the people we love, our survivors. We are missing the chance to talk about what's real, important, and inevitable. We miss the opportunity to plan what happens to the remaining members when one family member's expensive last stage care could empty the family coffers. I have one more question. 5. What would it take to get that conversation started with someone in your family or with anyone who is safe for you to start death conversation? No one can predict, not even the doctors, and maybe especially not including the doctors, whose situation is futile or near futile, perhaps with extreme measures leading to a bit of life extension. In my case, it was 12 days. 12 from the first symptom to the emergency room to get malignant fluid pulled off of my lung. I can safely say that this was a highly charged time. It's extremely lucrative for a system that benefits by marketing to people in urgent situations and with small margins of hope by fueling our insistence for possible life extension that we can't afford to pay for ourselves and whose outcome can't be guaranteed. Your pain, your confusion, and your not having these family conversations create the marketplace. The marketplace that thrives in the space between the near futile and fear of the inevitable. We each decide or fail to decide for ourselves. For me, and I'm trying to be so good about my I statements here, for me, this is an environmental issue. An important driver of my behavior is concern over source reduction and sharing limited resources. I look for opportunities to use less of limited resources, and that includes living in a way that obviates the need for treatments and uses less health care, like living responsibly, avoiding processed foods, eating whole foods, exercising, maintaining a clean home environment, and leading an examined life. I don't get it all right, but it also means for me things like limiting air travel. Politicians focus on who pays for things. They can't send stick it to you messages about reducing the need for so much treatment by taking responsibility for your health. But I can ask you to at least think about the issues. If you want endless care, regardless of keeping the habits that make you sick, at least admit it and have a real discussion about what it costs for you to keep your sick, fun habits. If you want to be saved at all costs, at least admit it and have a real discussion about what it costs to pursue near futile rescues. At least admit it to the people whom you will leave behind depleted of resources. And just remember, we're all going to die. Cost-benefit trade-offs are a reality we deal with every day in our lives. The airlines and the car manufacturers deal with them all the time. It's just part of the calculus. But what about in our personal lives? I think about this kind of stuff all the time. How much environmental impact am I willing to have for a few months more of medically extended life? How much resources am I willing to use knowing that health insurance doesn't nearly cover the costs? Who suffers if I take more than my share? I'm grandma. Nobody is killing me, but I'll be dead soon. I'm in a unique position because, let's face it, who's going to bash me now? I'm even more in touch with my environmental values than I was before I became the first person in my entire family to develop cancer. It's not cancer that's killing me. The cancer is simply the mechanism by which nature will return my particular body to the earth. What's killing me is corporate avarice and the failure of the political environment to create safe forums for sane discussion on polarized issues. And the issues include regulating our harm doers, and that includes both those who benefit by making us ill to begin with and who benefit when we treat. It also includes dispassionate discussions about the rational rationing of limited resources without charges that somebody is trying to kill grandma. Here's my personal take. I statement, personal take. I don't want 1 cent given in my name for cancer research. We are headed in the wrong direction, focusing our brilliant minds and resources on treatment when the rising incidence of so many cancers is environmental. And that means prevention. That means living responsibly. That means reducing the need for care at the source. No matter what you do, you will die. Won't you take a moment to ask yourself the 5 questions? At least if you're going to demand the impossible of the environment and the policymakers who legislate the future for your children and grandchildren, at least you will do it with your eyes open. Here are the 5 kitchen table questions again. 1. Do your loved ones know your wishes around treatment and life extension? Have you documented them? Number 2, would you want your life saved at all costs? 3, would you say save me at all costs if you had to pay for it? 4, would you say save me no matter what if it meant that you used up the family resources, leaving little or nothing for the living and the more comfortable dying of your survivors? And 5, what would it take to get that conversation started with someone in your family or with anyone who is safe for you to start death conversation? Thanks.